Hello, welcome to Aging Well in America. I'm Anne Marie Gattari, your host. Today we are going to talk about something that is affecting all of us, but especially our elderly loved ones who may feel a bit confined during the winter months, and that is the winter blues. We have with us a special guest, Rebecca Palen, who is a social worker and therapist in the local area, and she is going to talk to us about how we might be able to do something about those winter blues. Welcome, Rebecca. Thank you for coming this morning to join us.
Thank you for having me.
Well, define the winter blues. What does that mean?
Well, I actually just brought a really specific definition because I wanted to capture it all. But if you were to categorize it, it's really just mild depression, lack of motivation, and low energy that we experience with the darkening days, especially this time of year with the new change of light. There's a long period there where we wake up and it's dark, and when we're coming home or even around dinner time, it's getting dark.
Okay.
And that's when we see a lot of increased depression that might also be situational. And that can happen because during the winter we have holidays.
Talk to us about what situational. That
Okay.
sounds like one of those good words
Yeah.
that we should.
So for instance, mainly when the winter blues hits most of us, it's January, end of January, February. So if you think about it, November, December, major holidays. And oftentimes the holidays aren't as cheerful for people as we think.
But there's always that anticipation, right? We're expecting them, we're hoping they'll be cheerful, so we're in a lighter mood and we're busy.
But the thing about the holidays too, especially for the elderly, is they've had probably a lot of loss. So when the holidays come, there's a period where they're missing their loved ones more because their loved ones would be with them in the holiday. So especially as we age, it tends to not always be as cheerful as it used to be.
So what can we as family members do to alleviate some of that? I realize we're after the holidays, but it's still
So some
relevant.
of the important things are to make sure they're getting enough light. So one thing would be making sure their windows are open more often. They're going out of the house, even if it's for short trips. I know even currently it's so cold out, but even if you could get them to those doctor's appointments rather than postponing them, or getting them out to church or social gatherings, that's really important. And then with the lack of sunlight, vitamin D is really important.
Okay.
So making sure that they've had that tested from their primary care doctor and making sure they're taking the right vitamins along with that.
Are you a proponent of those lights?
Yes, those artificial lights.
Yeah.
Yes, you can
are.
get those locally, and that's actually on my little list. So if you can't get them out, say that they have some inability to get out mobily, you could get one of those artificial sunlights. They're called sun lamps. They're about $30, and they can use that about 2 to 3 times a day.
Oh, really? Just plug it in and put it on. Don't look at it, correct?
Right. And then you also could even get them to sit closer to a window if they don't want to get the light with the shades open.
It occurs to me, I know for my mother, taking her out in the winter was difficult because she had COPD, and breathing the cold air was really difficult for her. So what we would do is just even put a scarf or those turtles over her mouth, just to, for the short walk to the car, and of course the car was always warmed up.
Right.
So there are little tricks like that.
And a couple other things that help is keeping them active. So if your loved one belongs to a local gym, or even getting them to socialize, even those short walks from the car to maybe a bridge game, or from the car to the doctor's appointments, is still getting them moving,
right,
and still seeing the natural light.
Right.
And then in addition to that is making sure they're eating healthy. So oftentimes, we all do this, we want to hibernate in the winter, and that's when we increase carbs or sugar, and those are the things that actually make us feel worse.
Is that right?
So we want to make sure they're getting enough protein, enough water, and that they're also eating a balanced meal.
Okay. Okay. When you talk about going out to a doctor's appointment, it occurs to me that maybe make that the day out, and tack on lunch.
Yeah, that's a great idea.
Tack on going to SOC, services for older citizens, to your local senior center if you don't live in the Grosse Pointes or Harper Woods, Clinton Township, St. Clair Shores, Harper Woods, Roseville,
Socialization
East Point.
Huge.
They all have great senior citizen centers.
Yes, so socializing those places would be great. And if you can get them out, even if it's twice a week, like you said, tacking it on to maybe a visit to the doctors or even church Sundays, go get lunch, brunch afterwards. That's always important.
Okay. So take apart the winter blues a little bit, because I think a lot of people dismiss it. Oh, it's cabin fever. Oh, you know, you'll be fine once spring comes. But it could be very real, and I'm assuming have some lasting effects, if not treated in the ways that you're recommending.
And that's a good point. There's mild depression. So someone who might be feeling the blahs or the blues and they don't really want to go out, but they do go out. Or that they are not as social, but they're still being social. So when we get into the lack of doing normal activities, not leaving the home, really not socializing, that's when you might want to bring a professional in and really identify if there's more than depression. And sometimes depression can mimic grief, and so that's also a good time to have a professional brought in, because you don't want to suffer from the winter blues probably longer than about 5 weeks.
Oh, really?
Which is pretty hard in Michigan.
Yeah, it really is. When you talk about grief, I think most of us think of grief for a recent loss, but you can grieve somebody who's been gone many, many years.
Exactly. And especially when you're more alone. So if you're isolating, then your thoughts go to who's not around you anymore. And you bring up a good point, too. Grief is not necessarily a death of a loved one. It could also be if they had recent health issues, or maybe their families moved away. And if we're talking specifically about the elderly, if they're going into an extended care facility, there's a big transition period there. And that's when you would see a grief-like symptom that might mimic depression.
Do some of these facilities that you know of, assisted living centers or long-term care centers, do they have social workers on staff to help with that transition?
Sometimes. It just depends on the facility. I know a lot of them have an ability to get a social worker to come help the residents. You would see a social worker on staff more for the rehab or the extended care facilities, so more of a nursing home setting.
When there's a true medical issue, right?
So assisted living, that's where maybe the family or the person who's in charge of the assisted living needs to sit down and brainstorm ways to get those resources. Because there's probably social workers that would come into the facility, or you could go see in a private setting.
And that is something that you offer through
Correct.
your, talk to us a little bit about your practice. It's a very, I love the premise, H3.
Yes. H3, it stands for Hope, Healing, and Health.
Hope, Healing, and health.
So I try to display the continuum of where you start with hope when you need some extra help, and then you're going to have some healing, which comes with resources or the support you would get from a therapist, and then health, which is a big term, but with my support or even other resources to continue to your wellness. But as far as helping the elderly, one thing that I would do is go into a facility and help them brainstorm.
You would go to the facility?
Depending on what the needs were.
Okay.
I mean, if it was local, close to my office, I would rather them leave, have the socialization, and come to my office. But if it's a facility that they can't, or the person can't really walk, say, for a short period of time, I would go in and evaluate and see what needs they need. I started my career in medical social work, so I have a tendency to be pretty strong in resources, but I don't do case management any longer.
Okay.
So I would be coming for more emotional support. So for instance, if your loved one was grieving, not only did maybe he or she just move into a facility, but maybe lost their spouse in the last 2 years, or might have had a loss that's giving them more than just the winter blues, I would come and formally help them through a process of grief recovery or any kind of emotional mental health support that they would need.
How does this process start, Rebecca?
A phone call or an email to my website, or calling my number, which is 586-335-2006. And then I would take an intake. And fortunately, many services, especially for people over the age of 62 who have Medicare, it's covered. So there's a minimal cost because I'm credentialed with many insurances.
Okay, so you do, for your private practice, you take many health insurances as well as Medicare.
Correct.
Oh, that's good to know.
Yeah, so that helps for people who are nervous about the cost but could use the support.
Okay, so a family member, probably an adult child, might be the one to reach out initially, and then you would kind of walk them through the process as that.
Exactly.
When you say you have a lot of resources, but you don't do case management, what does that mean exactly?
Well, if someone called me and I'm meeting with someone and they identify mom's not eating enough, I definitely would be able to provide them a list of maybe Meals on Wheels. Or maybe brainstorm with the family, okay, mom doesn't want Meals on Wheels, she doesn't want so-and-so coming into her home, but we need to get her eating more. So maybe it's finding
A nutritionist?
A nutritionist, exactly. Or even a home care agency that could do companionship and get them to go out to lunch and drive them. And then other things, if I don't know it, I would definitely be able to find the person to refer them to. So for instance, maybe a diabetic who needs extra help with supplies and can't afford them. I would help them get in touch with the American Diabetes Association.
Oh, okay, that's a really good point. So depending on what their diagnosis is, there is help. I didn't realize that for sometimes medical equipment, sometimes, well, always for education, I'm assuming. But diabetes is a big one.
Or even support groups. I mean, with the amount of people being touched by Alzheimer's, diabetes, now I have several clients with ALS. I also would make sure they get even the family, in addition to the patient, the support groups that are being offered, like you said, the educational seminars, because once you go to those, they're a great first step for resources.
Yes. These support groups for Alzheimer's, I know in this area, the Alzheimer's Association has 2 support groups that it is holding in this area. One is at SOC, at Services for Older Citizens, and the other one is at St. Michael's Church. And they both are different times of the month, but they each run once a month. So calling the Alzheimer's Association is one way to find out where those resources is. You may have them also on your website. Okay. So that's great advice on how we take care of our parents. How do we take care of ourselves so we can take care of our parents?
So for the caregivers?
Yeah, the adult child who may or may not be involved in direct caregiving.
So,
but is certainly responsible or sees him or herself responsible for the well-being of
and you're exactly right. You can't really take care of someone else until you take care of yourself. So caregiving groups are always great for emotional support, as well as seeing a therapist, even if it's getting a place to vent about all the extra stress that you've taken on caring for your loved one. And the same things that I say to all my clients, making sure there's a holistic approach to your balance. So making sure you're eating right, sleeping right, drinking enough water, having that emotional support, socializing enough. And a key thing, too, is exercise.
I knew you were going to say that.
Well, and certainly the American Medical Association the last couple of years have said exercise treats mild anxiety, which we would definitely get taking care of our loved ones, and depression better than medication. So the more you move, the better you feel, but you really are releasing serotonin in your brain, which is going to make you mood-wise feel better. So as much as you're so exhausted after taking care of your loved one, if you even could get like a half an hour walk in a day, it's certainly going to help you feel better and then be able to take care of your loved one.
I have to tell you a little story. When my mother, the last 2 years of her life after my dad died, she had pretty severe dementia, and grieving his loss actually made it more so. My one sister worked out with a trainer, and she was religious about keeping her appointments no matter what was going on. And there was no reason why she shouldn't. There were certainly enough of us
That's good.
to jump in. I, however, on the other hand, let it all go because it's hard for me to do more than one thing at once. So I just zeroed in on my mom. Thinking back, my sister handled everything with a lot more a sense of calm, and she seemed to be more reasonable even in our discussions when I think back how I was feeling.
So she had an outlet. That's the key part. Yes. You can't really have the outlet in front of your parents, and you probably had children at the same time.
Sure.
and a spouse and
Yeah.
work. So where do you let all that out?
Yes.
So it could just be simple meditation when you're walking or going to the gym. It doesn't have to be anything. A trainer's awesome, but it can definitely, that time commitment can sometimes be overwhelming. So if you even just make it as simple as put your shoes on, get outside for a half an hour.
Right. I just read in, I think it was Sunday's New York Times, about interval walking.
Oh, yeah.
Not running, but walking. Walk hard and fast for 3 minutes and then walk at a moderate pace. Do that for 10 minutes, 3 times a day, total of 30 minutes, and there were results.
Yeah,
This was
walking's
part
so
of a
great for you.
research. Yeah.
And inexpensive.
Yes, yes. So you can do it outside, not today, but
Right.
or of course on a treadmill. Well, that's all really great advice, and sometimes it really is just easier. Again, I was there, I know, just to keep your parents in the house, keep them,
Right.
you know, bring all the resources to them and try to take care of things there.
But there's a good feeling too when you help your loved one get out.
Right.
They'll thank you, they'll appreciate it more, and you forget until you do it.
Yes.
I mean, I remember caring for older grandparents and being like, God, I should do this more often. But we get caught, like you're saying, in
Yeah.
that mundane
Yeah.
routine where we're making it easier for everyone,
Yeah.
so we think.
We need it to be simple. So that's, as you said, maybe even an agency that has caregivers who can take them, or even transportation that can be hired if it's not.
Yeah, companion care is so important because it also gives you respite care. So when you're caring for someone, even though you don't necessarily want to spend the money, in the long term, you're going to feel better, even if it's a few hours a week.
That's right. That's right. Tell us a little bit about yourself and your background and how you started H3.
Well, okay, let's see. I graduated my Master's of Social Work about 10 years ago and started at St. John Health, and that's where I had a lot of medical social work.
What did you do as a medical social worker?
So we were responsible for being in the hospital, and we would get a referral for anything from resources to emotional support or anything identified by physicians and nurses.
And these were patients in the hospital that you were
inpatient,
asked to see.
And then probably about 3 or 4 years into that, I switched and became a specialist in oncology. So that was outpatient social work, where someone would be coming to a cancer center, and I would help from finances to just adjusting to the illness, to transitions to maybe home with hospice, or to a facility for care if they were elderly.
So
depending
it was
on the diagnosis.
logistical as well as emotional?
It was.
You were doing both?
Yes.
Wow.
And then there was a lot of financial. A lot of times when people are hit with any significant illness, there's a lot of financial impact on the family.
Yes.
And so that's kind of where I identified I wanted to spend more time doing the emotional work, and that didn't really lend itself because it was fast-paced. A lot of people are touched by cancer, and so it was pretty quick.
So you really had to, in that environment, deal with the issue at hand.
Correct.
Someone is in rehab, they're being discharged. Do they have this, and that in place? How do you make it so?
By the way, I'm leaving, and I just want to tell you I lost my husband, and I have been crying for 2 months.
Yeah.
So that's where I identified why I wanted to go into private practice, which was being able to see someone for an extended period of time in the session, but also for weeks, and could follow them and see them improve, and be able to give them the support that they needed emotionally.
Okay.
So I opened H3 about 6 years ago, but it was very part-time, and now I'm full-time doing that consistently for the last 2 years.
Had you always taken insurance? Were you always
No,
able?
that has helped so much. So in the last 2 years, I've been credentialed with over 10 insurance companies.
I see.
The major ones in Michigan. So that has also lent itself for H3 to grow.
Right.
Because people are able to come in an easier setting.
Okay. And where is your office? Where do you see people?
It's right in St. Clair Shores as you're coming down Mac, right before 9 Mile.
Okay. So it's south of 9 Mile going north.
Yeah, very close to Grosse Pointe, very close to the freeways. So my clients come from all over.
Okay, very good. Do you see families?
I do. Oftentimes I'll start with a client that's identified a need, and then they decide to bring in mom or dad or child or brother or spouse, or sometimes a whole family depending on what the need is. And normally when it's a chronic illness, that's when I do more family work, because cancer, Alzheimer's, any other progressive disease affects the whole family at different stages.
Okay, All right. Rebecca, I'm sure you get this question, especially by our elderly loved ones, but you're young. You're a young woman, but certainly not inexperienced. You have a lot of years of experience, but do you have maybe skeptical clients who say, she's too young, she can't help me? And how do you overcome that? I'm sure you do.
It was a lot harder 10 years ago. I mean, I hopefully will continue to age gracefully. But that definitely, I remember being in the hospital, people even said my voice was too young on the phone. And so we learned that in graduate school how to handle that, how to respond. And I might not have had the exact experiences of my clients, but I can be empathetic and I can help them get where they need. And that's what I want to give them, is an ear and a place for them to find their own solutions. So oftentimes, it doesn't matter, say that I was seeing a couple and I've not been married 30 years.
Right.
That's okay, because I can at least relate and help them find where they need to go.
Sure. Are you from this area?
I am. I grew up in Grosse Pointe. I went to Grosse Pointe South, and I actually stayed and did all my graduate work in Ann Arbor and at Wayne State.
Okay. All right. You received your undergrad and your
master's
of
social work at U of M.
Okay.
And then I got my second master's at Wayne State, and it's for public administration.
Oh, okay. So you certainly are credentialed.
Lots of school.
How do you like your work?
I love it.
What do you like about it?
I think what it gives me is it gives me a place to help others. I kind of grew up volunteering a lot. My mom and dad were big people in the community that did a lot for, if it was for PTO or Girl Scouts or church things. So I always saw a helping hand. That was part of my models. And so I like to say that I help a lot of people in that way. And the other thing is I like to just be in a room where other people are having human issues, because we all have them. And so often people say, how do you sit and listen to people's problems all day long? One thing is I at least am able to give them somewhat of a solution. And if not, they leaving happier or at least relieved. And so it doesn't really tire me out. I do a lot of good self-care though. So again, exercising, making sure I eat right, socializing, because if I didn't have that self-care, I think burnout could happen a lot easier.
Sure, and that's probably quite common with a lot of therapists and social workers.
And nurses.
And nurses, absolutely. Caregivers, we see it in everywhere, really. We just can't emphasize enough, as you call it, self-care.
Right.
But also caring for our elderly loved ones, who unfortunately can become a burden, and that is their biggest fear, right? They say, I don't want to be a burden. And in so doing, they actually become more so, because they're trying to do something for themselves, which too often, sadly, becomes, there's a mishap that becomes...
and resentment sets in, and
yes,
burnout and all that. So.
Yeah. So getting back to then what we can do in this, in the thick of winter, here we are, but we're looking spring squarely in the face.
Hopefully in about 6 weeks.
If we could just reiterate maybe some of those.
My main message would just be stay active, making sure you're engaging in life, even if it's at little increments, getting out of the house, and then making sure that you're treating your body right, because we often want to hibernate, which in its sense doesn't really lend itself to being healthy.
So if we can't get out, if that really is out of the question, that doesn't mean you throw out all the other ideas, right? Right. You could have people come over, you could have...
and even do your hobbies. So finding your passion, your creativity, that will give you joy. As long as you're finding joy in your day. And then also get on the phone and socialize, or reach out on social networks.
Sure.
Whichever way you can connect with people.
Yeah, have a grandchild bring over an iPad and set up an email account.
Yes, that would be good.
A lot of grandparents and grandchildren connect.
Yep.
That way. That's a new fun thing to learn. Well, thank you very much for being with us today.
Yes, I appreciate it.
This is a very, very real issue, but as I said, I think we tend to dismiss it. Oh, it's just cabin fever. It's just the winter blues. Well, as you said, it can, if it lingers too long, and I think you said more than 5 weeks, we really need to
Yeah,
take
and
a
interesting,
look.
this is the busiest time for my practice. So
It
people
is.
aren't feeling good
Yeah.
emotionally. So if it's the winter blues or something else, this tends to be when people reach out. So
Okay.
that tells you something.
Okay, very good. So again, if we could just get your website and your phone number.
Sure. My website is actually www.hope-healing.health.com. And then my phone number is 586-335-2006.
Okay, and we'll put those up on the screen. Well, I'd like to thank you again for watching another episode of Aging Well in America. As always, we are interested in the ideas and topics you would like to have us explore. Please do send your ideas, your letters here to the Grosse Pointe War Memorial. And we'll see you next time. Thank you.